We also want to really try to understand your ability to oppose one joint to another. And joint opposition, or the movement of one in one direction versus the opposing joint in the opposite direction, happens throughout the body. And it's really, really key, especially in our spinal mechanics, in how we move and how we walk. So for example, as I walk, if I was to have my pelvis tilting forwards, this has to pair with an arching of my low back, equally a tilting of my rib cage or pulling the chest out, and then a relative tucking in of the chin. These movements should be paired as one. The opposing motion would be tucking under the pelvis with a sinking of the rib cage and a forward motion of the chin. These movements are paired together. But many people will struggle to oppose these motions. So spinally, we first want to see, can you now integrate everything together and try to, number one, in this plane of motion, forward tilt the pelvis, arch the low back, chest out, chin in, or do you really struggle to access some element of that? Versus tucking under all the way, rounding the low back, really tucking under, the knees may bend slightly, compression or kind of tilting of the rib cage with a forward motion of the neck. When we try to do that side on, we want to see, can you hike the pelvis up or down on one side? And we do this by dropping one knee with a drop of the rib cage or the shoulder into that side and keeping the head in the same place, not leaving it over here. So this would be opposing or stacking the joints in opposing directions in a side-to-side motion, one way versus the other. And finally, we want to test your ability to oppose motion in rotation. If my hips turn me one way, do you then really struggle to keep your rib cage going the opposite direction and then the neck the other? Or if I'm rotating this way in my hips, I'm now going to go here with my rib cage and here with my neck. How does that feel for you? Do you struggle one way versus the other? Then we can break it down even more really simply into segments. So for example, if you have, or you found that you have really poor neck rotation, what about keeping your neck still but rotating here? Because now I'm still getting relative motion of my neck even though my head is still. Or is the opposing thing true? Can you extend the neck or poke the chin out and get this motion versus this one? Which element do you struggle with? So it's just a way for you to practice a more integrated look at the body and how things pair together.